Welcome to Let's Talk Jonesboro. Our guest today is Alicia Storey, and Alicia is the Director of Imaging Services at St. Bernard's Medical Center. Alicia, welcome first.
Thank you.
You've got a new unit for mammography. Please tell us a little bit about it.
We do. We're really excited. We actually got in the mobile mammo business way back in 1998. We put our first unit on the road. We replaced that unit in 2004, and just yesterday we officially launched our third unit that will replace the one we put out in 2004.
And this is a high-tech, I guess is about the size of a school bus?
It is. It is a huge RV, especially when you sit behind the wheel. It seems like it takes up the entire road. We worked with Armor Mobile Systems out of Ohio and built the coach custom from the ground up. So we were part of the design process, even on the inside. So we got to be a part of making sure that it was going to be pleasing to our patients and very accessible and a good experience for them.
Now, why would you have a mobile mammography unit? Why would that be important?
So access to mammograms is not always easy. So there are several areas in the communities that we serve and all across the state of Arkansas actually who don't have fixed mammography facilities. So for some women, they may have to drive 2 hours to get their mammogram. We know that breast cancer is a very treatable disease and even curable if we find it early. And the way that we do that is to increase screening mammograms. And there's lots of barriers and lots of reasons why women don't get their mammogram. So the mobile program exists to help eliminate those barriers, and one of those is access. So not every woman in our area has access to transportation and can travel that far to get it done. So instead of them coming to us, it's easier for us to go to them in some situations. So that's one of the great benefits of our program.
And in talking to doctors and hospital administrators, it's been interesting for me to learn that they think the number one impediment to health care in Arkansas is transportation. So what you're doing is really a great thing for women, and I guess for men too, because breast cancer doesn't really discriminate.
That's true.
So
it's much less common in men, but it does affect some men. That's true.
So tell me what age women should first get a mammogram.
So women begin yearly screening mammograms at 40. Okay. And we only do screening mammograms out on the mobile. So that's for women who are not having any breast problems. They don't have any lumps or anything that they're concerned about. And it's been at least a year since they had their previous. So starting at 40, the recommendation is every year after that. Any woman who finds a lump in their breast, having some sort of discharge or some sort of problem, they would need a diagnostic mammogram. They would need to go in and speak to their physician, get that checked immediately, and they would have a diagnostic mammogram.
There are 4 of these machines, these buses are in the state of Arkansas. How big an area do you serve?
So we serve 18 counties in northeast Arkansas and 2 in southeast Missouri. And we do collaborate statewide with the 3 other mobile units so that we look at the entire state of Arkansas and we utilize our resources most effectively and most efficiently to go out and reach all of those communities where fixed mammography is not available.
And Alicia, I know the technicians are particularly, I guess, pretty talented, because you mentioned that were you joking when they said they have to have a CDL? Or?
No, we're not joking. So
okay.
We have 4 ladies that are mammographers, and they travel out on the mobile unit, and they perform the mammograms, and they also drive the bus. So they did with our new unit. It's larger, the motor's bigger, and it's heavier, and it did require CDL. So they were a little nervous about it,
yeah.
But they all successfully passed, and they drive that thing like champs. It's impressive.
I bet it is.
Yeah.
I bet it is. So they're I guess you said truckers as well as
truckers and mammographers, and yes,
truckers and mammographers.
Yes,
it's a great combination of
right.
skills. So what do women and men need to know? I guess really this is Breast Cancer Awareness Month. Well, it was in October, but it's always Breast Cancer Awareness Month. So tell us a little bit about things that people should be aware of.
Sure. So you're right. For us, even though October nationally it's recognized, we live and breathe this every day. So it's a passion of ours every day. So we like to spread the message about early detection. So it's important for women who qualify to get their yearly mammogram. It's also important that women start getting clinical breast exams. So when they go to their physician for their wellness visit or for a visit for another reason, that they're having conversation with their physician, the physician's doing breast exams, and then also that women are doing breast self-exam. So that all three of those things together, sometimes there are things you can feel that you may not be able to see, and vice versa. And that in combination helps us to detect cancers very early when they're treatable. So that's our message, early detection.
Now this bus is called the MamMobile, and you can't miss it on the street. It's bright, beautiful pink, and it's heading out. How many days a week does it travel?
We go out about 5 or 6 days a week.
My goodness.
And sometimes 7. So we have actually expanded our services. We continue to see a great demand and need in our community, and we're doing all we can to meet that need. And this new mobile is going to allow us to expand our coverage and be out on the road more days. So that's a good thing.
That is a good thing. That is a good thing. And now you're a director of Imaging Services at St. Bernard. I mean, I'm old enough to know that imaging has come a long way in the last half century. So can you tell us a little bit about the things that you've seen and what we can do now that we couldn't do 10, 20 years ago?
Absolutely. So specifically in breast, way back in the day, imaging was we used film. So we dipped it in chemicals, and there were dark rooms, and it's very similar to photography. And over the years, of course, it's evolved and gone digital. And specifically with breast imaging and mammography, as recent as just a few years ago, we had 2D digital mammography, and it took just a 2-dimension flat image of the breast. And now we have 3D tomography, so that the machine actually sweeps when it takes the image, and it takes images of the breast in layers. So that allows the radiologist who interprets those exams to kind of scroll through the breast in layers, almost like turning the pages of a book. And so the more they can see, the better they can detect cancers. So even with just that technology, we've seen almost a 20% increase in early cancers detected. So that's
right?
great for our patients.
That really is. That really is. And I don't know what the state of the art is on CAT scans or MRIs. I think I've had both of those, and it's all right. But
The technology is amazing, and it evolves so quickly. So we're always looking for the next thing and the best thing, and every time a new technology emerges, we're able to see more detail and find things earlier and so much more treatable, and it's been very impactful to overall health for our patients.
Do you think people have come to a point where they're really comfortable with this, or are people intimidated when they come to these situations?
I think people are nervous. I mean, I think it's just normal for all of us to worry and, be afraid that something serious is going to happen. And that's a big part of what we do in healthcare, not just, the technical aspect of finding the cancer or finding a pathology, but also understanding the state of mind. Sometimes when our patients come in, they're scared and they're afraid and anxious, of what we may find. So that's a big part of what we do also, is make sure that we are compassionate and we understand where our patients are coming from and try to put them at ease.
But one thing we all do is, I think, try to wish something away. And so it's important to be proactive, push yourself, get out there. And now you've got the MamMobile coming to your city, coming to your neighborhood, get on the bus, right?
Get on the bus, absolutely. We have patients sometimes, we hear women say, well, I don't want to know. But what we try to really drive home is breast cancer is a very treatable disease.
It's very treatable.
And so you do want to know. You want to know when it's early and have a minor procedure and have to, maybe skip chemo and radiation and those things that a lot of us are scared of. But even at that phase, medicine has come a long way. those treatments are much easier on the body. They have much better outcomes, and so we really try to encourage patients to be proactive in their health, get their screenings, not just mammograms, but colonoscopies and all the screenings that are available. Wellness is key.
It is, and we are blessed to have great healthcare professionals in Jonesboro, and one is Alicia Storey. Alicia, thank you for
Thank
taking the
you.
time to visit with us today.
Thanks for having me. I appreciate it.